give you this in more detail right now. Should be tailored again to whether your patient is sensitive or constitutionally strong. So constitutionally strong patients can usually start on amphotericin B nasal spray, starting with 1 spray or atomizer once a day and working up to twice a day. Sensitive patients should probably start on nasal nystatin. For patients intermediate in reactivity, I will start with itraconazole 1% or 2% ketoconazole nasal spray. Now, one of the things we've learned is that mold, fungus, and candida make a great deal of biofilm. This is basically a type of polysaccharide glop that coats the microorganisms, shielding them from antifungals and from the patient's immune system. So we have learned that it's very important to add biofilm dissolving materials to what we're treating with. So I typically use a compounded nasal spray containing EDTA with an atomizer, or what used to be called BEG spray. I've eliminated the G, which is gentamicin, and I typically use BE spray to treat the biofilm and the nasal spray concurrently. I then turn my attention to the gut, and I start Argentin 23 orally, 1/2 to 1 teaspoon a day, followed by, if the patient has gliotoxin or on their O test, evidence for an elevated arabinose, candida is very likely. Most of my patients have candida also. So I will often, but not always, add nystatin, 500,000 units, starting with a low dose once a day and working up to 4 times a day. I will then add Sporanox, which is also called itraconazole, 100 milligrams. For my sensitive patients, I will start with 1/2 to 1 Sporanox every 2 weeks. For a constitutionally strong patient, once or twice a day. I'm now using more and more amphotericin B as an oral solution. Keep in mind that although it has a terrible reputation, amphotericin B is not absorbed through the mucosa, and it does not have systemic toxicity. So you can use it in small doses in the gut to help remove your fungal elements. 2 products that I like to dissolve biofilm in the gut are MCBFM from Beyond Balance or Interphase Plus from Claire Labs, 1 or 2 capsules a day. Here are some of Dr. Brewer's papers which go over some more treatment. I would